Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, professor and vice chair for research in the Department of Family and Community Medicine at Meharry Medical College. Also, principal investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL. I'm also the site PI for HealthWorks, a HRSA-funded COVID prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, November 28th, 2022. Coming out of the Thanksgiving weekend, COVID conditions across the United States are up slightly, but still fairly stable. Dr. Anthony Fauci from the Centers for Disease Control and Prevention said the administration was optimistic that we're not going to see a repeat of what we saw last year when the Omicron variant swept through the country. After over 2 years of living with COVID, we are learning to adapt to a world with this disease. In the first 2 years of the pandemic, nearly 15 million people died globally, and over 100 million Americans have died. But despite all of this and all of the grief and hardship that COVID has brought, it has also had some silver linings. Today, I'm going to offer some thoughts on some of the positive developments that COVID-19 has brought about. First is the development of the mRNA vaccines. A second development that COVID has brought about is the increased acceptance of working at home and the use of Zoom and other teleconferencing platforms to do so. A third significant development has been the increased acceptance and coverage of telemedicine. I shall talk a bit about each of these positive residuals of COVID and then conclude with an update of the number of new cases, hospitalizations, and deaths, both nationally and in Tennessee. mRNA technology has been in development since the 1960s, but it has proven most responsive when SARS-CoV-2 hit the world. In a nutshell, mRNAs are messenger ribonucleic acids that elicit an immune response from cells before degrading. They work by introducing a sequence that is coded for a disease-specific antigen, a substance that causes the body to make antibodies against it. Once this antigen is produced within the body, the immune system can recognize it and get ready to fight the real virus, bacteria, or parasite. The success of mRNA technology in combating COVID-19 has resulted in renewed interest in developing the technology for other diseases. Before the COVID-19 pandemic, exploration into mRNA vaccines for a range of diseases had begun, including Ebola, Zika, and rabies, as well as cancers and influenza. The mRNA vaccine field is now developing extremely rapidly, in large part in response to COVID. A large body of preclinical data has now been accumulated over the past several years, and multiple human clinical trials have been initiated. Emerging research suggests that mRNA vaccines have the potential to solve many of the challenges in vaccine development for both infectious diseases and cancers. mRNA vaccines appear promising because of the speed with which they can be developed and produced, and their flexibility and adaptability to variants. Clinical trials have already begun or are expected to begin this year for mRNA vaccine candidates for HIV, malaria, and tuberculosis. In addition, a new mRNA COVID flu vaccine targeting all known flu strains and 2 COVID variants in a single shot is showing early promise in animal studies and is opening the door to a wide range of possibilities with the vaccine technology, including potentially the next influenza pandemic. Unlike seasonal flu shots that protect against existing circulating strains each year, This shot could theoretically produce immunity against all new flu strains. In addition, both Moderna and Pfizer currently have mRNA vaccines in clinical trials that combine COVID and flu shots. The combined COVID flu vaccine could be available as early as next year. Second, while the demand for flexibility in where and how people work has been building for decades, COVID has hastened this process. Before COVID, surveys showed 80% of employees wanted to work from home at least some of the time. Over a third would take a pay cut in exchange for this option. While the experience of working at home during the crisis may not have been ideal, as whole families were forced to shelter in place, it, it gave people a taste of what it could be. This genie is now out of the bottle and it's not likely to go back in. Over the past several years, the primary driver of work at home programs has been the attraction and retention of talent. But during the last recession, it was largely about saving money. Since that time, occupancy studies have shown just how inefficient office space was being used. Other advantages of employees working from home include more agility and flexibility in working arrangements. With employees no longer tied to an office, they may be better placed and more willing to work flexible hours, such as earlier or later in the day, or even on weekends. Home working also has helped retain employees, as the flexibility of home working can help employees meet childcare needs, reduce their commute, and enable them to fit their work around their personal life. Working from home provides better work-life balance. Working from home can help employees in giving them more free time in the evenings. Working from home eliminates the need for a commute to work that can be stressful, as well as enabling staff to get extra health benefits such as additional sleep, spending more time with family, exercising, or preparing healthier meals. Financial benefits to business also have been realized, including savings on office space and utilities, office supplies, and other facilities. Staff may also be able to take advantage of the tax relief available from working at home. Technology has made this transition easier. The internet has made it possible for staff to be continually connected to the office. Tools such as Zoom have made communication between colleagues and teams much easier and at times can lead to more efficient and effective meetings. Third, COVID has helped facilitate access to healthcare providers via telehealth without spreading or getting COVID-19. Telehealth has been used to help patients get the care and monitoring they need without having to leave the comfort of their home. Telehealth options now enable people to get follow-up care after leaving the hospital or their physician's office. It also has expanded the use of remote patient monitoring devices, enabling healthcare providers to check on your vitals while at home. For example, remote devices are being used to check blood sugar levels and monitor blood pressure. Telehealth enables patients to get support for specialty care faster via telehealth than waiting to see a healthcare provider in person. Telehealth is now being used as a bridge between in-person appointments. It is used to schedule appointments, make referrals, refill prescriptions, and send electronic copies or records to other healthcare providers, including specialists or new primary care providers. So, as we reflect on the devastating impact that COVID has brought about, let's not forget some of the positive changes it has also brought. Nationally, COVID cases have risen modestly in the past 2 weeks to around 42,000 per day nationwide, while hospitalizations have risen 4% to 29,000 per day, and deaths are up 4% to 330 per day. Test positivity rates are up 13% over the past 2 weeks compared to 11% for the prior 14 days. Higher test positivity rates are a sign that many infections are not reported, even if they are tested for at home. This results in a more severe undercount of cases. The number of hospitalized patients with COVID increasingly is seen as a more reliable measure because testing is more consistent in hospitals. While the rates of COVID have increased slightly, the expected surge has not yet materialized, although it is still too early to tell if we are going to see a significant spike. All in all, however, there's a lot to be thankful for. In Tennessee, the number of new reported cases of COVID-19 are down 23% over the past 14 days, a significant decrease from 11% 2 weeks previously. Hospitalizations and ICU stays are both down by 5%. Hospitalizations to 398 per day, while deaths are down 34% to 7 per day, or less than 0.1 per 100,000 of the population. Currently, no counties in Tennessee are in the red zone, while only 4 this week are in the yellow zone. Counties in the yellow zone include Sullivan and Hawkins counties in northeast Tennessee and Rhea and Lincoln in southeast Tennessee. A total of 91 of 95 counties in Tennessee now are in the green zone. Much to be thankful for, indeed. For now, this is Dr. Paul Juarez from the Tennessee SEAL and HealthWorks at Meharry, wishing you a good day and a happy holidays. Be safe.